Cape Cod Broadcasting weaves the listening environments of 99.9 WQRC, Ocean 104.7, WFCC Classical 107.5, Cape Country 104, and CapeCon.com's website experience to reflect the lifestyles of the people who live, work, and play on Cape Cod. We hope that you enjoy this podcast.
Good morning. I'm Laura Reckford, and this is Sunday Journal. I'm here in the studio with Heidi Nelson, CEO of Duffy Health Center, Dr. Wesley Klein, Duffy Medical Director, and Louise Patrick, Duffy's Director of Behavioral Services. Welcome to you all.
Hi, Laura.
Thank you.
Hello.
Let's start with an overview of Duffy for people who may not be familiar with the organization. Heidi, can you tell us about it?
Thanks, Laura. The mission of Duffy Health Center is to prevent and end homelessness through health care. We offer a unique blend on Cape Cod of medical services, mental health and substance abuse treatment, and then case management, which we wrap around those individuals that have the most difficulty finding and keeping their housing.
And how do you reach out to people who are eligible for the services?
Well, interestingly, our data show we served about 3,000 people last year. People often ask how many people are there who are homeless on the Cape, and that number is hard to, as you can imagine, counting homeless people can be a challenging endeavor. But the way we like to think about it is that anybody who is low income and has a need for multidisciplinary care is a good candidate for Duffy services. So we served 3,000 people last year. About 750 of those are people that you and I would recognize as literally homeless, people who are living on the street or living in the shelters or camping in the woods. But there's a whole additional group of people who are living in other people's homes, on their couches, in their basements, sort of in unauthorized places. And so we can also serve individuals who meet those criteria. To answer your question, people find out about Duffy. Our data shows that about 35 to 40% of our patients hear about Duffy from a friend or a family member. So certainly for people on the street, it's word of mouth, but we also people learn about Duffy through a friend from church or somebody at work that they know. They're having trouble with a teen with addictions, or somebody who has lost their housing and really needs health care and other support services.
And we know over the years when there have been studies about underserved clients on the Cape that there are those people you talk about who, while they might not be literally homeless living out in the streets, they're underserved with regard to health care, and I assume that those are the people you're trying to bring in.
Absolutely, right. We know that about 10% of the population in Barnstable County has an income below 100% of the federal poverty level. That's very poor. That for an individual is about $13,000, $14,000 a year. For a family of four, that's about $23,000, $24,000 a year. And all of those individuals, for the most part, are eligible for Mass Health and could be Duffy patients.
And you mentioned Mass Health, and so how does it work with insurance for Duffy?
So we bill all insurances except for commercial insurance, but we also we bill Medicare, Mass Health, all of the connector care products that are offered, the subsidized products that are offered through the state. We also bill Harvard Pilgrim because that's the insurance plan that the students at Cape Cod Community College receive, and we do get a number of the community college students are really living on the edge and could benefit from Duffy services. So we get a lot of referrals from them as well.
And do you help people to sign up? Because sometimes just that bureaucracy of signing up can stop people from doing that.
That's a great question. We had, before this last year, we had 2 full-time people that's all they did was sign people up for health insurance in our existing patient population. about 20% of the people who walk in our front door walk in without health insurance. And the other 80%, their insurance is usually pretty messed up, so we have to, do a lot of work with them. But then we hired a third position this year with the Affordable Care Act and with federal funds that they gave us to do more outreach into the community and not only help Duffy patients sign up for insurance, but all kinds of people sign up for health insurance. So we went to the community college and we went to the state welfare office also to help people sign up for health insurance.
So people who are listening perhaps to the show and if they're not signed up and they meet income eligibility, they can actually go to Duffy and get help with that and start the process.
Absolutely. 94 Main in Hyannis.
And now you had mentioned the 3,000 people you served this year. Is that up, down, staying about the same? How is that going?
Well, we had a very significant growth in our patients, about 25% increase in the number of patients and visits that we did about 3 years ago when we moved into our new building. So I just mentioned our address at 94 Main Street in Hyannis. We have what we still consider to be a brand new building, medical on the first floor, behavioral health on the second floor, and so that's our location.
And I remember when that was built, and it's interesting to note that Duffy was actually founded. Was it in a closet at the the Noah Homeless Shelter? You've come a long way from there.
That's the legend, is that we started in the broom closet at the Noah Shelter.
But obviously it's come a long way, and that segues into Dr. Klein. You're Duffy's medical director. How did you end up to be working at Duffy, and what's your background?
Well, originally I grew up in Texas, went to medical school there. And started a residency actually later in life. Was sort of looking for some place to do primary care, family medicine, and this is a good fit for me. Serves a population that really does in need of medical care, and trying to help them with both their physical, mental, and substance abuse issues. Kind of doing a lot of different things. It's interesting.
And what about Duffy's program makes it effective for this population?
Well, we've sort of gone to a medical home model, which is a kind of a buzzword right now. Medical home refers to the idea that patients should get almost all of their medical, behavioral health type services, really anything they need in terms of health, wellness kind of stuff, from one primary location. The idea was years ago people would see 5 or 6 specialists for everything. And the idea is that primary care should be the hub of the wheel. And the patient will need specialists most of the time during their life, but they should have most of their medical care, medical information coming from one source that sort of coordinates things. One of the problems with healthcare, it's so disjointed and so uncoordinated, and there's so much duplication and waste because we don't know what the other side is doing often. So at Duffy, what we have that's very helpful is that we have behavioral health, which means we have counselors in the building. In primary care, that's a big, big plus. Even in the primary care out in the community, a large percentage of your patients have mental health issues of some sort, depression, anxiety, and being able to have counselors in the building with you that you can talk with is definitely a plus. And then we also offer the substance abuse component, the treatment for opiate addiction, and as well, which is another thing that's nice to have in the same building.
And maybe you can talk a little bit about that. Vivitrol, we hear a lot about that and how that works physiologically and so forth.
Yeah, we have basically we offer 2 office-based treatment programs. One of them is called Suboxone, and Suboxone is a pill that the patient is prescribed. That works, people are very familiar with methadone and how it works. Basically, it's replacing heroin so that the patient doesn't need to steal or do things they shouldn't do and allows them to function better. Suboxone came along a while ago, and it's the idea that patients can be treated for their opiate addiction with a medication that is what we call a partial agonist. What it means is it allows them to not have the cravings. It allows them to not go into withdrawal. But at the same time, they're not getting high from it. And they can function and work and be members of community and really do everything they need to do to be a participant in society. In addition to that, they have to be seeing behavioral health as well as part of our program. And again, it's really a very helpful thing for a lot of folks. The Vivitrol is a newer product. It's actually a drug that's been around since the 80s called naltrexone. They realized that they could give it in a shot form, and the person receives a shot once a month, and it blocks the receptors for opiates, meaning that people don't get high. It also works for alcohol abuse. People that drink don't crave alcohol as much, and if they do drink it, they don't get much of a positive feeling from it. So it's indicated for both alcohol and opiates as well. So those are the two things we offer there, is the Vivitrol and the Suboxone, along with counseling and the medical care.
And you had mentioned the behavioral health services, and that brings us to Louise, and maybe you could talk a little bit about what that is and how that works with the rest of the program at Duffy.
Well, as both Heidi and Wes mentioned, Laura, we do have integrated care, and that means that all the patients have a team of providers. And, I was thinking about this the other day, and it's not just their medical provider, the primary care provider, and their behavioral health provider, but I would include our medical assistants and our RNs, their benefits counselors. We're all a part of the same team, and it's something that I think is a real benefit to the patients. They feel really, Heidi used the word wraparound services. They really feel cared for, and they can come to us for a variety of issues. I think there's been pretty significant recognition that primary care and behavioral health are intertwined, and medical and psychosocial or mental health issues are it's hard to differentiate them. So we really do have to work together. And we, in addition to our opiate replacement therapy, we also have psychopharm services, and that is a psychiatric nurse practitioner who prescribes psych meds to our patients who require that. Some of our primary care providers also provide psychiatric meds, as you often see in primary care these days. But we communicate on a regular basis. We have a morning huddle as a part of patient-centered medical home to review the patients that are coming in for the day or the patients that were here the previous day, and kind of troubleshoot problems. We have group treatment. We go over to one of the sober houses in the community and provide group treatment there. We have interdisciplinary team meetings. We have individual counseling. So we really try to provide a variety of behavioral health services and coordinate very closely with the primary care providers, as well as the case managers, who are almost like an extension of the therapists. So it's a great team approach.
Now, many of your clients have been exposed to trauma. So what is the trauma-informed care, and how do you treat that?
I can speak to that, Laura. It's no surprise, I think, that people that have been homeless or people with substance abuse or mental health issues have a history of trauma. And so what trauma-informed care means is that we are sensitive to the fact that people have had very difficult lives, and we work with that. I mean, they may present with a lot of symptoms that are kind of hard to deal with, certain behaviors that they may have learned as survival techniques when they were younger, and we try to work with them about developing new coping skills. So they don't have to throw a tantrum to get what they want, as they may have had to do when they were growing up in a difficult situation. So we are sensitive to people who have experienced trauma. We try to work on new behaviors, and we're able to set limits around inappropriate behaviors too.
And another issue with the clients, perhaps, or you had mentioned that there may be some drug use, and perhaps that's been a form of self-medication for psychiatric issues. What is the process for dealing with those dual diagnosis people?
Well, that's what I think we're kind of set up for in a good way, because we have the substance abuse treatment programs there, and we also have behavioral health there in the building. So, yeah, it's a kind of a 360 thing. Almost all of these folks have had trauma.
Yep.
So from a medical provider standpoint, when you see them, you are cognizant of that, and it's not that you have to delve into it, but you're aware that most likely there's something in their background that was probably not good, or a series of events, or maybe even most of their lives. And you just have to be aware of that they'll deal with those things.
And if they're presenting certain behaviors,
Absolutely.
we're prepared to deal with that.
Anxieties,
Yep.
severe depressions,
Yep.
suicidal,
Self-harm.
side thing, people that have been to the emergency room because of overdoses. All of those are, red flags. That things aren't good.
And I think the approach that our clinical staff take is that there's people consistently comment on employee satisfaction surveys about how they're treated with dignity and respect, and that they are so used to being rejected by the mainstream system that to come into a place where we practice something called motivational interviewing, which is we ask you where you want to start in your treatment. We don't tell you, well, you need to get sober, and you need to take your diabetes medications, and you need to do this, and you need to do that. Where we start is where the patient wants to start. We're going to end up probably in the same place,
Yep.
but it's where do they want to start on their journey.
And then Duffy may have some other programs that we should mention. We only have a couple minutes left, but did you want to mention any other programs?
I guess I would like to just highlight, it's been in the news lately about our work with the Main Street Initiative looking at the development of a day center in downtown Hyannis. We have actually converted the NOAA shelter to a 24/7 operation. So from our perspective, how wonderful it is that people have a safe, comfortable place to be during the day. They don't have to pick up all their stuff and wander around town trying to find a comfortable place to be. But it's also a place where we can engage with those individuals and bring them into treatment. So the merchants love it because the homeless are off the street. The police love it because they can shepherd our folks over to the 24/7 operation, and the service providers love it. We're all working together. And just as Chief McDonald said the other day, he hasn't seen anything like this in any other community. So we're doing something really special here.
Well, this has been a very interesting discussion about Duffy Health Center. Unfortunately, we're out of time. I'm Laura Reckford, and this is Sunday Journal.
This podcast is a presentation of Cape Cod Broadcasting, which is solely responsible for its content. Thank you for listening. For more information, please visit us at capecodbroadcasting.com.